The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 Long Island News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Today we live in crazy times. Times where up is down and down is up, left is right and right is left. I keep telling people, you must have faith. Have faith and watch the miracles happen. In my practice, I treat you as family. We have faith and we watch the miracles happen. Last week, I discussed medical marijuana. I'd like to follow up because, the show's short. There's so much material that we have to cover. So I just want to go over real quick a summation of what we discussed. Medical cannabis, it was passed 7.5 years ago. It was implemented January 2015. I was considered a pioneer in New York State. I'm the first to open up a medical practice in New York City. I certified over 1,300 patients who qualify with a condition to be treated with medical cannabis. The plant itself has 400 chemicals. We use 70 cannabinoids that have the medicinal properties. The two main chemicals, it's THC and CBD. Structurally, they look identical. However, CBD is lacking one bond. Since it's lacking one bond, it's going to be a different characteristic. Since it has a different characteristic, there will be a different receptor. And those receptors are not found in the central nervous system. THC has a CB1 versus CB2. Those receptors are found in the central nervous system, and that's why individuals who take a lot, especially recreational users, high dosages of THC, they have these what we call psychoactive properties, and that would be the stoner's high, anxiety, paranoia, increased appetite, which we call the munchies, and then sedation, you fall asleep. So I left off with the delivery systems. We have 4 delivery systems in New York State. That's the vapor or inhalation. Then we have a tincture or sublingual. We have a oral. That would be the lozenge, a tea, which we use the leaves and you can dip in like tea. And then we have gummy bears as well as pills and capsules. The last delivery system, the 4th, would be a topical lotion. So let's discuss ratios, okay? Because last show we didn't include ratios, and then we'll conclude the show, and then we'll go into today's topic, which is obesity. I'll define obesity. So we have 3 ratios, and doesn't matter what part of the world, there's only 3 ratios, and the ratio is the percentage of THC versus CBD. The first ratio is high CBD, low THC. So this particular ratio has all the benefits of CBD. What are the benefits of CBD? Has cancer-killing properties, anti-inflammatory properties. It reduces dull, achy pain, that crampy, spasm-type pain, muscle tremors, and it also keeps you very, very focused. So ratio 1 has all those benefits and almost no benefit of THC. Ratio 2, the THC and CBD ratio, it's equal. It's called a 1-to-1 ratio. So you have the best of both worlds where you have all the benefits of THC and CBD. What are the benefits of THC? THC kills cancers. Well, it stimulates appetite, has excellent sedation properties. As we know, that's part of the psychoactive properties, but we can use it for medical benefits, both appetite stimulant and to help as a sleep aid. It also blocks neuropathic pain. So we have the best of both worlds. Ratio 3 is all about THC. So it's high THC and low CBD. So it has all the benefits of THC and very, very little benefits of CBD. So when a patient comes into me and they have a qualifying condition, I sit them down, we do a thorough history, and I do a physical exam. And then I review their history, and together as a team, we discuss their needs. What are they looking for? And together we choose the best ratio that would benefit their needs. For those patients that suffer from diabetic neuropathy, I'm going to pick a ratio that's going to have a higher THC property, a ratio. So we have the THC properties to block that neuropathic pain. For someone who's needs a sleep aid, then I'm gonna focus more on a high THC versus CBD. And this is one of my pet peeves. If you go back for the past 3.5-4 years, you saw CBD. It was the CBD fad, CBD tea, CBD brownies, CBD coffees, CBD drinks, cookies. However, one, you don't know what you were getting in that product. It's not regulated, so you're counting on the quality assurance based on the whoever's producing that particular product. You're also spending a lot of money. However, the government and the producers not telling you when you should and shouldn't take CBD. CBD is not a stimulant, but it's going to keep you very, very alert. So when it's time for daytime, that's daytime's alert time. That's when you want to be awake. Bedtime is sleep time. So I don't want to give you something that's going to keep you alert when you should be sleeping. And when you buy these products, they don't tell you, CBD, daytime, not nighttime, okay? There is a percentage of people out there can take a very small percentage of my patients that can take a higher CBD and still fall asleep. But the average person, I tell my patients, you're going to take your CBD during the day, and they come in, Doc, I'm having problems falling asleep. I said, well, when are you taking the product? And then when they describe it, I said, well, didn't I tell you CBD during the day, not at night? And when they come, they said, oh, boy, I was taking it exactly opposite that what I explained to them. So that's why you have to have follow-ups. And then once I correct it and they come back, I said, nope, I don't have any issues sleeping. So you have to understand when and when not to take these ratios. Also, online, I know a lot of patients are signing up for these $149 online to get your medical marijuana cards. They're not getting the best care there. I'm sorry, you're just not getting the best care because they only have 10 to 15 minutes. It takes 10 to 15 minutes just to certify and register you. There's no education involved. I spend an hour, that's right, 1 hour educating my patients so they have an understanding what their condition is, why they're being treated, how the medication is going to work. And then we choose the proper ratio, and then I certify and register them. So it's not a 15-minute process. Remember, you get what you paid for. And we're living in a time that we're getting what we paid for, all right? And if you know what I'm talking about, just look out there. The whole world's crazy. This is what you wanted. This is what you voted for. This is what you got. Well, it's the same thing with medicine. You get what you pay for. So in my practice, we sit down and we discuss everything together. My patients, like I said, you're like a family to me. I'm going to give you what's best for you. I'm not going to mislead you. That's not how we practice medicine. We discuss it together. We come up with a plan together. It's called an assessment and then a plan. All right, so we're getting ready to go into the second half. But first, I would like to, again, offer this opportunity that if you'd like to get a free book, if you have a Kindle reader, go to my website and then go click the contact and type in your first name and request a free book. I had several individuals reach out to me and I sent them a copy. So I'm still offering. I have a few copies left over that I can send to you. This is a wonderful opportunity. It's about a 2-hour read. You're going to learn about who I am and what I offer the community. Also, if you missed shows, past shows, or you'd like to hear the shows again, go to my website, drtommyo.com, click Ask Dr. Tommy O, and that will bring you to a page with all my website. All right, so we got a few more minutes, not even that, a few more seconds. I'm going to go to break, and we'll come back and start discussing diabetes. So to learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Gap Road, Suite 16, which is the garden level, East Patchogue, New York. Or give me a call at 631-980-8200. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. Today's topic is obesity. Second half of the show, obesity. This is very important. We discussed diabetes and hypertension, so we need to discuss obesity and the significance of obesity. So let's just define obesity. Now, obesity is common, it's serious, and a costly disease. Did you know having obesity puts you at risk for many other serious chronic diseases and increases the risk for severe illness due to COVID-19? And that's what we saw over the past 2 years. Individuals who had obesity or even morbid obesity, which I will define, their condition was moderate to severe. And the morbidity was very significant with individuals that were suffering from obesity and morbid obesity. So let's define obesity. Obesity is a disorder involving excessive body fat that increases the risk of health problems. What are those health problems? Now, we said risk, okay? In medicine, we talk risk. When you increase the risk, there's an increased chance of developing a medical condition or medical pathology or disease. So my responsibility is to educate you and help you decrease the risks. You can have all the risks in the world and still not develop a disease. Like you always hear someone, I've been smoking since I'm 15 and I'm 90, I don't have cancer. Well, that's very rare. We do have those cases, but those are the rare cases. So let's decrease risks. Now, what are those conditions that's associated with? Now, I'm going to just name a few that are associated with obesity. Hypertension, we discussed it. Why? We have increased resistance. When you have increased resistance, the heart has to work harder and your blood pressure goes up. Diabetes, we just discussed diabetes. Then we have what's associated with diabetes? Micro and macrovascular pathology. And that's where you have the hardening of the arteries, that plaque formation, where that's directly associated with increased fat in the body as well as cholesterol in the bloodstream. You develop plaque. We also have heart disease, right? Coronary artery, and that is associated with the increased plaque, right? You have blockages, and then we have decreased blood going to the tissue, decreased oxygen, decreased nutrition, and then we have cellular damage and then death, and that is a MI, or what we call a heart attack. Also stroke, we discussed stroke. Obesity is also associated with some forms of cancer. So obesity is often a result of taking in more calories than burned by exercise or normal daily activities. So it's input versus output. So if we're putting in more calories and burning off less, we're going to keep gaining weight. So you have an understanding. 1 pound of fat on your belly, on your backside, or on your thighs. 1 pound is in excess of 3,500 calories. So if you want to burn off 1 pound of fat, burn off 1 pound, you must burn in excess of your basal metabolic rate plus your activity rate plus 3,500 calories. All right. That's why when you get on a treadmill or you're on a stair stepper, stair climber, or you're running and you look down, you say, oh my God, I was on there for 45 minutes and I only burnt 100 calories. Well, we have to burn in excess of our calories, what we call the basal metabolic rate, the calories for our daily activity, plus the 3,500. You only chipped away 100, 150, 200. We got a lot of work to put in to burn off that 3,500. So how do we do it? We burn off the excess calories and our caloric intake, we lower it. So according to the CDC, the U.S. obesity prevalence is about 42%, and that's back 2017, 2018. And with each year, that number increases. From 99 through 2018, obesity has increased from 30% to 42%, as I just mentioned. During this time, the prevalence of morbid obesity increased from 4.7 to 9%. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. And this is among the leading causes of preventable diseases and premature death. The estimated annual medical cost of obesity in the United States is $147 billion, and it keeps going up every year. What do? We need to set up an appointment with Dr. Tommy O. Let's do a history and physical. Let's do a baseline blood draw. We'll do your lab work, and we'll see where your cholesterol level is. We'll determine what your body weight is, which I'm going to go over now, and then we'll form an assessment and a plan. Let me help you lead a happier and healthier life. Let's decrease these risks. Life is about risks. Why take risks? Risk versus benefit. In this case, the benefits are low, so why would you take on these risks? Let me help you reduce these risks. So how do we determine body weight? People's perception is obesity, and they look at an individual that has a very, very large body. No, that's a misconception. So let's determine body weight. So we use a unit of measure, and a unit of measure is the body mass index, and that's one way. And there's another way. There's another formula which I use because when I got my master's, and let me go over that. I have a master's in clinical nutrition. I graduated from New York Tech. That's right, New York Tech here on Long Island. And there was two formulas, body mass index, and that was a pretty complicated formula to memorize. So I focus on a different formula where I took the height versus the frame size. We also calculated your basal metabolic rate as well as your activity level, and that's how I formulated the amount of calories you should be taking in. And then we could calculate one's the definition. Are they overweight, ideal body weight, overweight, obese versus morbid obese? Today, it's real easy. You can go online and on your phone and download an app for body mass index, or you can go on your computer and just do a search, and you'll see a calculator come up. All you need to do is put in your weight and your height, and it'll tell you the body mass index. Someone who has a body mass index of 30 or lower, you're what we call in a healthy range. If you're 30 or above, you have obesity. And if you have a body mass index of greater than 40, you have what is called morbid obesity. Okay, morbid obesity. So let's go over, because I'm getting ready to wrap down this show. But time really flies. I'm at the 2-minute mark now. The way I calculate it, and I prefer through my practice, is I take an individual's height, and then I determine what their ideal body weight. And I also have to look at their frame size. So for an individual who's medium frame, that is 5 foot, let's say female, her base weight should be 100 pounds. Okay, so 100 pounds. And her range would be 100 to 110. For a male, same exact height and medium frame, instead of 100 pounds, is starting off at 107. And the range would increase 10%. So for this individual, a female, 5 foot, medium frame, 100 pounds, the range is 100 to 110. At 111, this individual is overweight already. That's right, 111, overweight. Now, if I go to 121, 122 pounds, this same individual, female, 5 foot, medium frame, is now overweight. Okay, now at 122, they're now obese. That's right, obese already. So 20% over ideal body weight, you're obese. If you are 100%, meaning let's say 220, 210, 220 pounds, you are now morbid obese. So do you understand that definition? It doesn't take a lot to go over your ideal body weight into overweight and then into obesity. So 20% over ideal body weight, you're at obesity. And this same formula applies to men. All right, so I know there's a lot of information to cover. I'll pick it up next week. So we're getting ready to close out the show. Let me help you lead a happier and healthier life. You wait, it's too late. To learn more about my practice, go to drtomio.com. That's drtomio.com, or call my office at 631-980-8200.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors. The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.